There's been extensive work looking at biomarkers for CDK inhibitors. So, they've looked at all proteins involved in kind of the retinoblastoma pathway, the CDK4/6 pathways, and nothing really has panned out as being definitive. In fact, the only real biomarker that's kind of been identified so far is the estrogen receptor itself. But I think, looking at some of the studies that we're talking about in my talk, it's certainly possible that there are cancers that are estrogen receptor negative that may benefit from CDK inhibitors. But I do think we'll have to do a pretty deep dive to work out which cancers they are. So there's been a huge amount of work both at the tissue level and also at the liquid biopsy level, trying to work out biomarkers that really would tell us which patients really need a CDK inhibitor. And nothing's definitive at this time point. Of course, we have a couple of adjuvant trials that we haven't seen full results of. The PALLAS study, which used palbociclib, which is reported as being negative. In other words, that the addition of palbociclib didn't significantly improve outcome. And then the trial with the abemaciclib, where they actually did see a signal of improved outcome with the CDK inhibitor. And that might be another, and those trials might provide some biomarker information for us. But again, it may be different in the early stage versus the metastatic setting. So it's one of the quest we're on, is to try and find that biomarker, but we haven't found it yet.